Hey guys, and welcome to another episode of Surviving Medical Bills, where we help you navigate through the obstructionist red tape of the medical insurance industry, step by step. Happy Labor Day, guys. And we're going to talk about help. I've burned myself grilling. Should I go to the ER or should I go to urgent care? Have you ever been at this crossword before where you've experienced the alarming medical bill because you chose to go to the emergency room? Well, on today's episode, we will discuss the difference between the emergency room and urgent care, as well as what they treat you for and how much it's going to cost. Let's look at the urgent care portion first. So, what does the urgent care usually treat? Well, for instance, some examples is they treat colds, flu, sore throat, fevers, allergic reactions, respiratory infections, mild asthma, general wound care, and simple cuts or burns and fractures and sprains. So, how much does an urgent care visit cost, whether I have insurance or not? And the estimate cost that you would accrue if you chose to use an urgent care center that's in network with your insurance plan, that cost is usually from about $50 to anywhere to the high mark of $200 per visit. And so one thing you want to make sure you do when you choose a urgent care facility to go to for treatment, you want to make sure, if you do have insurance, you want to make sure that that facility is in network with your insurance, because you don't want to run into where they're out of network with your insurance and certain services your insurance may not cover because they're out of network and not on your plan. But even if you don't have insurance, you're still going to accrue a cost about, estimate, like I said, between $50 minimum and $200 at the higher end. So that's just some things to remember when you choose to go to an urgent care facility. Now, let's talk about the emergency room. Usually, the emergency room is more expensive. Emergency room visits are more than twice the amount of an urgent care center. Most emergency rooms, they have a deductible that you have to meet if you're using your insurance, and you're usually going to pay about $500 estimate, and that's not even including the charges for what they actually treat you for. So a key thing to remember about if should I go to the emergency room, you only want to go to the emergency room if it's a major life-threatening issue. Usually it's medical issues you would normally call 911 for. So for instance, if your arm is pretty much halfway torn off, you don't want to go to an urgent care facility unless that's the closest place that you can get to. They can at least start treatment there and then get you to an actual emergency room. But if you can get to the emergency room, if you had not called an ambulance, you want to make sure that you go ahead and go to that emergency room, because that's the best place to treat you. But if it's something like a cold, or you're just not feeling well and can't quite pinpoint what it is, and you can't get into your primary care physician, say for instance it's a Saturday, it's a weekend, or it's a holiday like today's day, go to go to the urgent care, because the ER is going to charge you that $500 plus treating you for something that they could have treated you for at the urgent care, where you could have paid it, minimum $50 to maximum about $200 estimate. So one thing before I go out, it's always some key things that I want you guys to remember. And that key thing for today's show is to don't go to the ER for treatment if it's something you can get your primary care physician to treat you on, if you can get into his or her office, or you can just go to urgent care center. Because if not, then guess what? That visit is really going to cost you. Okay. So listen, guys, if you like this information, or you know someone who could use this information, please make sure that you like this video as well as share this video with that person. And don't forget to subscribe to this channel. And don't forget to click the bell to be notified when a new video is posted. Also, if you would like to receive a free copy of my new e-guide, which is Understanding Medical Insurance, which is a guide to help you understand and choose the right medical plan for you and your family, send a request to the email that's listed down below, and we will get that information to you. Until the next episode, you guys have a great day.